As a young doctor in England, I was surprised by the large number of Nigerians that were traveling to the UK for infertility treatment. Infertility carries a big stigma in Nigeria, and it's very difficult for couples with infertility to sustain a marriage, and people will go to any lengths for treatment. And I felt that the treatment that was being provided in the UK, it was possible to provide that same standard of treatment in Nigeria. So that was the inspiration. I think we've established IVF as a treatment of infertility in Nigeria. IVF has evolved to be the cornerstone of infertility treatment, and it's very difficult to offer infertility treatment service without access to IVF. Before we started at the Bridge Clinic, there was really one or two people were experimenting, if you like, but no, there was really no IVF clinic. So we started as the first IVF clinic. Today, we have 4 clinics in Nigeria. There are other clinics, so the technology is well established in Nigeria. Our values are very important to us, and they drive everything that we do. I think our first core value is pioneering. IVF as a science is not static. It's new developments coming in every day. So it is our objective to be part of this change. So we pioneered IVF in Nigeria. We pioneered the Institute of Fertility Medicine. We're pioneering improvements in pregnancy rates. We're pioneering the introduction of a lot of the genetics to IVF. So we have to constantly look at what's around the corner and be ready to move forward. We're conscientious because it's absolutely critical that we provide patients with what they need, and we don't just take advantage of them, which unfortunately that happens. And so we're very conscientious. Excellence is our third value. We believe that IVF is such an important field from a scientific point of view and also from the requirements of the patient. So excellence is key. Safety is important. The treatment must be safe. There mustn't be any risks to the patient. We must minimize every risk. Honesty. It's very easy to make claims about the treatment and the results of treatment. So we're very, very careful that in everything we say to our patients, we are totally honest. So IVF, involves a lot of emotions. And so we have to be caring. And so caring is our last core value. I think one of the things that I enjoy hearing when patients have been in contact with us is how friendly all the staff are at the Bridge Clinic. Right from the guy who opens your car door to the gate man, everybody meets you with a smile, because we all know why we're there. We know that we're dealing with people who are going through a difficult emotional experience. And I think the key thing is that the staff are focused on that. They're friendly, they're professional in the way they interact with the patients. And the environment that we provide, we try and provide a sanctuary, somewhere where people can come in and they know that the best is going to be done for them. Well, I think after 13 years of IVF in Nigeria, I think it became quite clear that the field of IVF and reproductive medicine is rapidly advancing, and there are a lot of new techniques, a lot of new treatments that we didn't have as part of our offering to our patients. So what we've done at the moment is we've just signed a collaboration/franchise agreement with one of the leading IVF groups in Europe, IVF Clinics Professors, ZEC, based in Bregenz in Austria. And the objective of this is that they have very high pregnancy rates, and they have a lot of new techniques that drives the excellence in their clinics, and we want to have that in Nigeria. So what we're going through a process of aligning our protocols with theirs, and then introducing new techniques like IMSI at a high level, introducing vitrification of embryos. Now pregnancy rates with frozen embryos, you can expect the same as with fresh embryos. So we're introducing vitrification of embryos, vitrification of oocytes. We're introducing an expanding genetics, pre-implantation genetic diagnosis for single gene defects like sickle cell, which is very common in Nigeria, about a 25% carriage rate of sickle cell, spindle view to improve the results of ICSI, and a lot of other things. But with the collaboration, every new development that is available in IVF anywhere in the world will now be available at the Bridge Clinic to Nigerian patients. So we're very excited. With the new relationship that we've just started, we will provide everything that any couple requires to achieve a pregnancy. Now, for some people, it may be simple reassurance and advice. Lose a bit of weight, advice about stopping smoking, not drinking too much alcohol, sometimes dietary advice. Going from there to simple treatments like ovulation induction in women who are not ovulating, to intrauterine insemination, to IVF, ICSI, IMSI, to more sophisticated treatment like pre-implantation genetic diagnosis. So whatever the couple require, our objective is to provide them with those services in Nigeria. Well, our vision at the Bridge Clinic is to be the benchmark for reproductive healthcare services in West Africa. And we decided to do that by reproducing the standards of treatment that is available in the UK, if you like. And I think with that clear objective, the quality of the treatment is as good as you will get in anywhere else in the world. Well, every patient is different. I mean, they all have the same medical diagnosis, but the causes of infertility are different. The response of the woman, each woman is different to our stimulation protocols. So it's absolutely critical that we assess every couple individually before we start the treatment. So it's critical that the treatment is individualized. Well, I think the key point with IVF is that IVF is a teamwork. You have teams of doctors, you have teams of embryologists or biologists, we have teams of nurses. And all our staff are trained as part of our quality management system. Everybody who has to deal with the patients must be certified competent to be able to carry out the requirements of the job. So we have a full range of skilled staff. We have independent counselors as part of our staff, and they provide a lot of the professional counseling. But I think it's very difficult to offer an infertility treatment service without having a big aspect for emotional management. So from a therapeutic perspective, a lot of the counseling is run as part of the treatment. But like I said, we do have the services of a professional counselor, and that's available for the patients as well. Well, quality management is critical in IVF because we need to assure our patients that the IVF that we provide is fit for purpose. I listened to a lecture in 2003 about quality management. It was at the Estuary Congress in Vienna, and it was very clear to me that this was the way forward. And I'm proud to say that as early as 2004, the Bridge Clinic was certified by TÜV Austria that our quality management system met the International Standards Organization ISO standards. We're one of the first clinics to go in this direction, certainly ahead of most clinics in the United Kingdom. And they've come every year since then to certify that we're improving. So this is critical because it assures our patients that the treatment that they get at the Bridge Clinic is fit for purpose from a quality point of view. 2004 was the first audit, and we've had annual audits since then. One of the things we're doing at the moment is that we've decided that we need to move from our current premises, and we're building a new clinic. And the new clinic will be the first clinic in Africa to meet the European Union tissue directives, because we've decided, as part of our vision of benchmarking, we will build a clinic that meets the standards of IVF anywhere in the world, because there's no regulation in Nigeria, and I think it's very easy to take everything for granted, but I think that would affect the quality of service that you provide eventually. So yes, there are no regulations in Nigeria, but we've decided to work as if we're a regulated clinic. So we're going to build our new clinic to the European Union Tissue Directive specifications. We focus on providing high quality treatment because we know that there's still a lot of Nigerians traveling over to Europe, to North America for treatment. And we say that if we can provide the same level of service as those people expect, then we should be able to at least provide those services in Nigeria. So our biggest challenge is the cost. So our cost is a lot higher than anybody else because we try and meet these stringent requirements. But I think it's an important thing to do. Absolutely. I mean, I think healthcare is not a commodity, and I think it's very easy to get it wrong. I mean, what value do you put on a baby? I mean, how much would you say it was cost effective? I don't think you can answer those questions. The important thing is that you go through safe treatment that guarantees you a healthy baby, and that's what we try and achieve. That's our objective. I mean, we spend all our efforts in achieving that. We know that it's very easy to drop standards, especially when there is no regulation. So we spend a lot of effort in keeping those standards up. So yes, so we will not be true to ourselves if we let the standards drop and say, the quality of service at the Bridge Clinic is not the same as you would get anywhere else. Traveling for medical care, such as IVF, is very disruptive. I mean, you have to take time off work, and usually because of it's a very private matter. So most people who go for IVF will probably stay in a hotel rather than stay with family. And this adds a lot of stress to the treatment. So our objective is to provide people with good quality treatment in their homes, so you don't have to leave Nigeria. When we started, there were a few people experimenting with IVF. So we were the first clinic to step out there and say, listen, this is what we do, and we're going to be held accountable for it. It was seen as a high-risk strategy because people believed that IVF was a myth in Nigeria and it was not possible to get results. So we did. We introduced the new technique then of ICSI, intracytoplasmic sperm injection. So we had the first baby born by ICSI in Nigeria. We also had the first baby born by ICSI with a man with no sperms in his ejaculate, azoospermia. We also had the first baby born with surrogacy, which surrogacy involves a commissioning couple asking someone else to carry their pregnancy. So we were the first to do that. There are other areas. There are other areas that we introduced, but we have a lot of awards for our achievements. We have an award from the Society of Gynecologists of Nigeria. We have an achievement award from the Guild of Medical Directors of Nigeria. We have a letter of commendation from the Lagos State government. So we've been recognized for what we've done. When I started the Bridge Clinic, I spoke to John Parsons, who was then the head of the Assisted Conception Unit at King's, and asked for assistance. So they came to Nigeria, and in the early days, they gave us the equipment specifications, the layout, and they assisted us with the setting up of the clinic. And in the early days, teams from King's will come to Nigeria to treat the patients. And eventually, we're able to transfer the technology to the Nigerians. And we still had King's coming in to ensure that we met the standards that were required. So it was a strong relationship, and we're now moving into a new relationship, and that's the relationship with the Z Group, as I mentioned earlier. And this is because, the quality from a European tissue-directed perspective, the Z Group would lift us from where we currently are. Well, I think the latest one we have is the KISS initiative, which is Keep It Safe and Simple. And this is an initiative aimed at young Nigerians, because when we look at the causes of infertility, tubal infertility is the commonest cause of infertility in Nigeria. And a lot of these are because of mistakes that young girls have made, such as getting pregnant, getting sexually transmitted infections which are not treated properly. So our objective is to educate them so that we prevent we reduce the number of people who will get infertility in the future. So it's keep it safe and simple, let it happen naturally. So we have a 10-point poster that's available on our website, and we also launch initiatives and distribute these at the universities. The other thing we've done, which I think is very important, is that there are so many Nigerians. Infertility affects everybody. It doesn't matter. It doesn't look at your economic level. But there are so many Nigerians that can't afford IVF. So we are very lucky that we are in a relationship with the Lagos State government at the Lagos State University Teaching Hospital. And we've set up a clinic there, the Institute of Fertility Medicine. So this is a clinic that will provide high quality IVF but at a subsidized cost. And the subsidy is being provided by Bridge Clinic. So of course we need to be sure that the patients who benefit from this are patients who need it. So of course we need to make sure that we look at we means test the patients to be sure that they need the service. So those are the initiatives. Those are two big ones. We also have our newsletters because we believe it's important to educate not only the people, the patients, but also the doctors. So we have a newsletter that goes to every doctor in Nigeria 4 times a year called Fertility Update. And we also have a newsletter that is released every month for our patients called The Birthright. And The Birthright is released at our open evenings called the Welcome Forum, which occurs on the 3rd Saturday of every month in all our clinics. And it's free. People come in and just learn about infertility. Sometimes meet other couples who are going through the same problem, some who have been successful, others who haven't. Well, I think it's important because infertility, there's so much ignorance about infertility and general other medical care. I mean, we also have another initiative called Doctors on Air, which my wife runs, and the objective of Doctors on Air, she's on radio every Wednesday morning, is to educate. We just have to educate and educate and educate so that people, learn to make the right choices about their healthcare needs. Because with no regulation, a lot of people will be exploited, and I think it's important that we educate them and assist them in making the right decisions. We're very excited about the future. We're at a stage now where there are a lot more IVF clinics, and we're very happy that we've established this technology in Nigeria. I think the future is about quality. Now, the technology of IVF is such that every clinic will get pregnancies. But, a pregnancy is a pregnancy, but the important thing is pregnancy rates. Because patients don't want to do IVF, they want to get pregnant. They want to do IVF once. And pregnancy rates mean that you offer the patient a chance to get pregnant quickly. Now, our objective is to go down that road. Most clinics, good clinics in Europe, like the ZEC group, would expect pregnancy rates as high as 60% in young women and overall pregnancy rates in excess of 50%. That's what we aim to provide to our patients in Nigeria. In addition to that, expand our offering, include a lot of genetics, which is also important, and just look at the value chain in terms of what patients want regarding getting a healthy baby, and we want to provide all those services. Absolutely. I think it's about the technology that you deploy. It's about the skills of your staff, and with the relationship that we've just developed with the ZEC group, we expect our staff to, part of it is that there'll be exchanges, a lot of our staff will work in their clinics, and they will come here to Nigeria and also assist us with the training of the staff. So if we can get the skill levels up, we use the same equipment, we use the same protocols, it's our intention to drive our pregnancy rates to the European levels. And, infertility is a big problem. It's not just a Nigerian problem. It's across West Africa. And so I think once we get it right in Nigeria and get those pregnancy rates, then I think it's something we can leverage.